The Congressional Budget Office has weighed in on the bill to restore cost-sharing reduction funding for insurance companies. I'm Bryn McBride of ABC for Health. We're talking about the move that happened a couple weeks ago where the administration said we are no longer going to fund cost-sharing reductions. Cost-sharing reductions is the money that goes from the federal government to insurance companies so that they can pass on enhanced savings in terms of out-of-pocket costs for individuals that buy plans in the marketplace. Now, on the cusp of open enrollment, this announcement by the administration that they weren't going to fund this procedure raised a lot of eyebrows and created a lot of instability. Right away, the Senate Help Committee, and we're talking about the Health, Education, Labor, and Pension Committee, sprang into action. Now, that is a bipartisan committee that right away put their heads together and said, we're going to start thinking about fixes for this instead of going down that path of repeal and replace like a lot of other conversations were centered on. And a lot of the credit is due to Senators Murray and Alexander. One's a Democrat, one's a Republican. They worked together and they said, let's restore funding for cost-sharing reductions. Let's do it for 2 years instead of this month-by-month thing that's been happening over the last several months. Let's also, while we're at it, give flexibility to state regulators in the form of how they go through Section 1332 waivers. These are state innovation waivers. This is what a lot of states have been thinking about for creating things like reinsurance or risk-sharing pools as they try to bring down costs statewide. Let's also broaden catastrophic coverage. Also written into their bill, their bipartisan bill to extend cost-sharing reduction funding, was adding what they call copper plans. Now, you might remember catastrophic coverage from when the marketplace first opened. It's intended for folks that are under age 30, the young invincibles that don't want to pay too much for health insurance, and it wouldn't cover too much, but at least it'd be something. It was still allowed under the Affordable Care Act. Well, this proposal said, let's open that up to more people. And in fact, let's just call it its own metal tier, using the same naming convention as the gold, silver, bronze, platinum that the marketplace has right now. Those copper plans would follow essential health benefits, but they'd be a little bit cheaper and a little bit more bare bones. They also said, let's not just restore outreach and assistance money. Remember, this administration defunded navigators and education and outreach to a large degree. The MurrayAlexander and Senator Murray bill says, let's put that money back, and in fact, let's add a little bit more. And then finally, they said, and let's not touch essential health benefits. Very different approach from some of the legislation we've been seeing circulated over the last several months. Now, the Congressional Budget Office did get a chance to review this, and they call it the Bipartisan Healthcare Stabilization Act. We call it Murray-Alexander. It's the same thing. They issued a score, and they said this proposal will reduce the deficit by almost $4 billion over the next 10 years, give or take. That was a big number, and that got a lot of people again, joining on. This bill has been circulated for co-sponsors. It's become very popular. Now, whether or not it can get a vote on the Senate floor, whether or not it can get some traction in the House, and whether or not the Trump administration and Trump himself will sign off on it is another story. But right now, this Congressional Budget Office report has been helpful. Now, a curious statement made out of the Congressional Budget Office is that they don't see that there will be an impact on the number of uninsured due to the Murray-Alexander bill. That is a little questionable, but it's probably just based on what they're using as their baseline. We know that the impact of cutting navigators and educational outreach money could impact about 1 million people signing up for coverage. We also know that getting rid of cost-sharing reductions might just scare people out of the marketplace. We also know that adding copper plans and opening up different options for insurance for people might bring more people to the marketplace. So impacting the number of uninsured or insured might just depend on what they're using as their baseline. Having this kind of compromise that's bipartisan is going to help fund cost-sharing reductions can only be seen as a way to get more people insured. So we'll see how this plays out over the next couple weeks and what the conversation looks like. You can read the Murray-Alexander compromise deal yourself. You can also read that full CBO report, and you can visit those links to read those yourself. You can always keep your finger on the pulse and join our conversation by sending us an email or asking us a question. You can do all of that on our website at healthwatchwisconsin.org. Thanks for joining us.